or at least talking to Israel about receiving a whole load of vaccine doses for the UK. And these were the same doses that the Palestinian Authority rejected, Mike, just 2 weeks ago. The PA rejected about 90,000 doses because Israel had said that these are okay, they don't expire till August. Then when the Palestinian Authority inspected them, they were due to expire this week. So this is the question: are these the same doses coming to the UK that are basically expired? Is this what's going on here? So this is a legitimate question which is being asked on this story here by Gilad. But actually, there's good records on this particular story. Take a look at this. This was just from a couple of days ago, as you can see, June 19th. What do we see here? The Palestinian Authority had canceled a deal to swap coronavirus vaccine doses with Israel. So in other words, they were planning to get them early from Israel and then return them in September when the PA got their allotment for this vaccine. So the PA said the doses were supposed to expire in July, August, but actually expired at the end of June, according to their technical team there. So human rights organizations in the West, the left-wing humanitarian organizations, were calling on Israel to give the vaccines to the Palestinians right away, but the Palestinians were a lot more cautious about the shipment which they're taking from the Israelis, Mike. But they go on here. This is interesting. So earlier in the day, Israel announced that it would transfer up to 1.4 million nearly expired doses of Pfizer's vaccine to the Palestinian territories. But then just beyond this, in exchange, the Palestinians would send them back again. And so this is from Naftali Bennett, the new prime minister's office here. So is there anything to be worried about if you're the Palestinians about this new prime minister? He, when you break it down, is actually a lot more hawkish towards Arabs and Palestinians than Netanyahu, if that's even possible. So you're talking about an extreme ethno-nationalist here is the new PM taking the reins in Israel here. And we just want to point people to, there's a whole lot of statements that you can dig up from Naftali Bennett's sterling Hall of Fame of quotes here. This particular one was one of my favorites. I've killed lots of Arabs in my life, and there's no problem with that. That's one of the more tame quotes that we've unearthed there. But let's just take a look at the Israeli press here. This is from N12. And so thanks to Gilad for translating from Hebrew to English here. The Israeli ministry fears the loss of hundreds of thousands of doses, has devised a creative solution. Britain may receive 1 million vaccines as early as next week. In return, the UK presumably will deliver to Israel the next shipment it receives from Pfizer in September. So the Israeli news item also points out that the Israeli Pfizer doses will expire as soon as next Saturday. What is going on here, Mike?
So they're coming here. Is this because Britain is doing such a sterling job of getting them rolled out that they'll get them out before the actual expiry date? Or is it because we don't mind too much what the expiry date is?
I think there's more than meets the eye in this story. Let's go back to Gilad's website and look at this. He's posted here, again, good journalism work here by Gilad Atzmon. Look at this chart, Mike. What does this chart basically say? Take a look at the dates along the bottom there. That's January right up to June 29th. And what do we...
Am I reading this correctly, that Israel hasn't rolled out very many jabs at all since April?
Yes. What it looks like, Mike, is that they've really flatlined in terms of vaccine uptake around the beginning of March, actually. So there's not been a lot going on. So according to the official numbers here, we have the Israelis, Mike, they're saying anyway, that there's 63% of Israelis have had it one dose, and around 53% have had double doses. So that's actually, the numbers are constantly changing. We thought there were much higher numbers than that months ago, but now those look like the official numbers, and that's really flatlined since March. So what's going on here? So, and again, this is Reuters here reporting this.
So basically what you seem to be saying is that they haven't been able to shift any doses since about April or so, which has meant they've got close to their expiry date. So what they decided to do was ship them into Palestine instead. The Palestinians said, oh no, we've got no danger of getting these rolled out before the expiry date, so we'll send them to Britain instead?
No, no, the Palestinians rejected them, and
Right.
Israel said, "What do we do with all this stock? Well, let's call up our friends in Britain and see if we can offload them in Britain."
Right.
Is that what's happening? It certainly does look like it.
And is this because people in Israel suddenly decided that they didn't want to be vaccinated after all? That were the adverse reactions lifting to a level where it couldn't be ignored? Is that what was going on?
There has to be an answer to that question, and that's certainly one of the obvious answers. I will point out that Israel blocked 1,000 doses of the Russian Sputnik 5, which it had got sent to Gaza from the UAE via the United Arab Emirates.
Right.
Those were for frontline healthcare workers. Israel blocked those Russian vaccines, but there was also another 40,000, I think, were due to be shipped after that, I suppose, when they resolved that controversy. So there's a little bit of a vaccine Cold War going on as well between the Western vaccines and the Russian and the Chinese vaccines. So again, we're seeing these vaccine borders that seem to be creeping up along geopolitical lines, and it's getting very messy as well. But just go back to that graph. I don't know if you can on that Gilad's graph there. So this really shows, Mike, that according to this, about 40% of Israelis are not vaccinated, and there's no sign that there's going to be any enthusiasm for more vaccines here. So that, in terms of the Palestinian side, we're talking about 5%. 5% of Palestinians out of the 4.8 million Palestinians in the West Bank and Gaza, only 5%, according to these statistics, have been vaccinated. So really low uptake in Palestine, and much like Australia, by the way, similar numbers there. So this is a great source of frustration to a lot of the public health mavens, those people on the payroll of the Bill and Melinda Gates Foundation, and just big pharma in general. So they're looking for ways, it seems like, politically, to try to crack some of these untapped markets.
Okay, now we have to issue a correction to a story that we did on Wednesday. Let me explain. BBC very quickly published this article following Wednesday's news. Misleading stat claims more vaccinated people die. So let's just have a look and see what the BBC is saying here. Some people, including those pushing an anti-vaccine agenda online, have been claiming a large proportion of those dying with the Delta variant of coronavirus had been vaccinated. One conspiracy site even claimed vaccinated people were dying at a higher rate than those that had received the jab, which is untrue. Well, unfortunately, Patrick, that was me, and it was incorrect. So I'm just going to clarify exactly how that happened. So we were talking about this document here, the SARS-CoV-2 variants of concern and variants under investigation in England, technical briefing 17. And we showed this table, the table showing all the Delta cases, the cases of the Delta variant. These are allegedly based on PCR test samples then going for genomic sequencing and genotyping. And the Public Health England was saying that from the 1st of February 2021 to the 21st of June, there were 92,029 cases altogether. But I made the error, let's say, of calculating the case fatality rate based on the full, on the all case numbers. So when I said this on Wednesday, I said that vaccinated versus unvaccinated, basically the case fatality rate was much higher for vaccinated than unvaccinated, which of course, on the face of it, it absolutely is. The calculation was correct, but I was wrong to base it on the totals. I should have looked at each cohort, the under 50s and the over 50s separately. So we're going to do that now. I also made the point that this is where the key problem arises. If you look at the numbers of people that are unvaccinated that were being labeled as cases that are under 50, it's 52,846, and over 50, it's only 976. What wasn't taken into account here is the number of people that are actually vaccinated at this point. So how many people over 50 are still unvaccinated? As a proportion of the total, it's not very many. And we see that also with the numbers of people that are just with one dose, but not quite at the point of the vaccine kicking in. So let's have a look at the actual statistics for over 50s. For vaccinated, the case fatality rate is 0.9%. So basically, you've got a 0.9% chance of dying if you end up with an infection after you've been vaccinated, and a 3.8% chance of dying according to those statistics. But we'll come on to that in a second if you are unvaccinated. But the BBC then went on to say they said, and there's another reason you cannot currently just compare the number of COVID deaths among vaccinated and unvaccinated people and come to any conclusions about how effective the jabs are, because most fully vaccinated people are over the age of 50 and therefore more likely to die, while most unvaccinated people are young and healthy. And so when we can, the fact is that when we consider that statistic that I've just shown on screen of the unvaccinated case fatality rate being higher than the vaccinated case fatality rate, well, this cuts both ways. So we actually don't know what people died of, because we've got to keep in mind that this is based on PCR tests, and we don't know whether what was actually genomically sequenced was an infection or something else that was picked up by the PCR test.
Or,
right?
or just a computer modeled variant that was created in the genomic software program, or something like this.
Right,
Yeah.
but there was one interesting thing that I just wanted to highlight from that statistic. If we looked at the case fatality rate for the under 50s, for the vaccinated, that calculates at a 0.01 chance of death for if you're under 50, if you're vaccinated. But if you're unvaccinated, there's a 0.011 chance of death as well. So actually, when you look at the figures correctly, what it seems to be showing, and anybody wants to correct me on this one as well, but what it seems to be showing is that the vaccine makes no difference to the survivability of the Delta variant when you're under 50.
Right. So what you're showing here on screen absolutely reflects what is the absolute risk reduction in terms of vaccines, rather than the relative risk reduction. So what they've been quoting, 95% effective, and all of these big giant numbers, which are relative risk reduction. This is what the media, the BBC, and everybody else quote. What you have here is closer to the absolute risk reduction. So again, if we go back to the actual BBC news slide previously, and you bring up their text, I don't know if you're able to.
No, well, I can't. But I'm gonna move on to the next little bit, because the next little quote from this article says, but the actual number of people dying would be much lower, and 20th as many as if no one was vaccinated, according to PHE estimates. The vaccines are already estimated to have saved 27,000 lives in England. Now, we are going to be producing an article on this whole thing later on today. Ian Davis is writing it as we speak, and we're going to be publishing it later on, which is going to go into this in much greater depth. But this issue of estimations, where's that coming from? Well, it's actually coming, before we come on to where it's coming from, let me just list the main takeaways here. This report from Public Health England, SARS-CoV-2 variants of concern and variants under investigation in England, is based on cases and PCR tests. That's the first thing to say about it. What was actually genomically sequenced? Was it an infectious agent, or was it some carryover from a previous infection? What was actually genomically sequenced? But as the BBC says, over 50s much more likely to die in general. But the question is, where do the estimates come from? It comes from this, the MRC Biostatistics Unit at the University of Cambridge and Public Health England as well. The latest modelling suggests that COVID-19 vaccines have prevented 7.2 million infections and 27,000 deaths. Now, this is what Sajid Javid was talking about on Tuesday when he was giving his briefing to the House, that it's based on the latest computer models. Now, is that a reasonable thing to claim, 27,000 deaths? The fact is, they have no actual evidence for that whatsoever. But the other thing that I just want to point out is they're claiming that they've saved 27,000 deaths, but they've avoided 27,000 deaths. But actually, we have 27,000 real deaths, which are additional excess deaths going on at the moment.